Something big is happening in Jamaica and it affects you. It's called universal health.
Universal what?
Universal health. It means everybody have access to health services no matter where you live or your ability to pay.
I have rheumatic heart disease, but I got Panadol. I get it once or twice a month, sometimes depends. But if they don't know, if a doctor is not here, they will give me a referral, send me by the Mark Health Center. There's a system that helps because I actually got it free. I don't know if when I was a child, because I have this kind of thing from I was a kid, so I don't know if back then my mother used to pay for it or anything like that, but no, I'm not paying for it.
Universal health means having access to a well-organized and funded health system. Quality care by well-trained health staff, no matter if you're living at the hills or in the town.
It improved here, especially through the new doctors in our here.
The arrival of the doctors from Cuba have been very good to primary care and to the Isaac Barnes Health Facility also. The reason for that is that we now have more doctors in the system so we can see more clients, because before we had the Cuban doctors, we had like 2 doctors that were stretching across primary care. Now, when they came, that was 4 additional right away. So we are able to see more clients, and there's also more continuity of care because persons now coming in more frequently, and the same doctor we are able to have at the facility. So the care is better as they are able to make appointments and reach out to the clients in a better way.
Universal health means health for all, no matter what race, gender, or sexual orientation.
So historically, the trans community have faced many barriers to accessing healthcare, particularly when it comes to receiving care from frontline workers. Their gender presentation, so either their identity or their perceived expression, have caused them to be denied access to services. So in Jamaica, things are changing. Access is increasing. People are finding avenues and opportunities to support each other, particularly with the involvement of civil society organizations to conduct sensitization trainings, to increase awareness through visibility campaigns, using social media to talk about the needs of the community, which is critical to access for all. Understanding how the different layers that affect the community has been instrumental towards that change. And if we look at how trans people are already vulnerable and marginalized, then we understand that there are additional barriers that we need to overcome. And having that common understanding from civil society partners and the Ministry of Health, it means that we are indeed making strides to increase access for all.
Jamaica is moving towards universal health, but more needs to be done to make sure we all have access to the care we deserve. We all have a role to play to encourage and support our leaders, so together we can ensure health for all Jamaicans.